Good morning, I'm Lori Hendrickson. We welcome you to the webinar this morning, Adjusting to a Suddenly Reduced Income, What Can I Do? As I said, I'm Lori Hendrickson. With me today is Antonio Alba Meraz. Antonio, do you want to say hello?
Sure. Good morning, everyone. My name is Antonio Alba Meraz, and I'm Extension Educator. Good morning.
And we are here today to talk to you about adjusting to a suddenly reduced income. We'll be taking you through some materials related to the theories behind how we deal with change in loss related to income loss, as well as some practical information. And we want to note that some of the information related to the CARES Act we know is moving pretty rapidly. And so we'll try to give you the best information that we have at this time. Okay, we'd also like to know if you will share in the chat area, what are some concerns that you have related to income loss? Please share those in the chat. And we have Sarah and Samantha that are monitoring our chat for us today. They are the people that organized this series of webinars, and so we appreciate them being part of it today as well. Sarah Kremens, Samantha Roth. And I see we've got some comments in the chat area. Lack of emergency funds is what we see. Also spending priorities. Other thoughts? How to communicate with your kids about what's going on related to the changing what you can buy and spend. Okay, and paying bills. Okay, great. Needs versus wants during this time. Yeah, there are really some tough decisions that need to be made. Hopefully we can understand a little bit of why these things are happening, and then also some strategies to move ahead. If reduced income, lower unemployment, what should you do? Find a new job. It's certainly harder. Yeah, that's one of the concerns that we have as well in addressing these things today. Great, thank you. All right, so as we move along then, we will, let's see, to find my arrow. Can't see things when I'm on the webinar here. Okay. All right, there we go. So today we're sharing our research related to income loss and change, also strategy to address income loss in order to use our resources as best we can, and then also some programs related to the COVID-19 pandemic to assist consumers. So we know that with unplanned income loss, there are many factors involved and it's complex. As the diagram here represents, there are overlapping areas of emotional, economic, and social effects. And so this diagram that you see is from a publication a number of years ago by Sharon Danis that we'll be sharing with you. It's called Adjusting to a Suddenly Reduced Income. Now, decrease in income involves the whole family, and each member needs to recognize the grief that they each feel over that loss, and that's that emotional piece. As a family, we also need to reassess how money will be used. That's the economic piece. And we'll need to make efforts to manage disagreements, because we know disagreements will happen when people have different priorities. And so this will help us to deal with the consequences that occur with unplanned income loss. When change such as job loss occurs, we tend to react in a certain way, and we all have similar feelings. You know, we all go through the fear, anxiety, and loss of control feelings, but when we're reactive to change, we let it happen and then respond or adapt to it, and we might see change as loss or as a threat. If we are proactive, then we are planning for change, we're open to new or multiple ways of working, and we might see change as an opportunity or attempt to reframe how we view the situation. And so there are factors that influence our response. Well, of course, how much change and how quickly it happens is part of it. A greater change or a faster pace can mean that people experience change as loss. And how much control you feel you have over the situation also contributes to how you view that change. How people view change can influence how they communicate about it, make decisions, and solve problems. And another piece of it is whether it's normative change, again, how we see that as maybe a normal everyday change that we all face, or if we perceive it as non-normative, that unexpected change, something that might be referred to as a crisis, such as this pandemic. Now, resilience is typically defined as the ability to bounce back from life's difficulties. And resilience might look different depending on the type of change and other stressors that are happening in your life. And in the context of normative change, resilience might be the continued ability to view change as an opportunity and the ability to manage at the speed of that change. Well, for non-normative change, that might be the ability to bounce back from the consequences that result from the unexpected change. And overall, you can think about resilience through these 5 characteristics: being positive, being focused, being flexible, being organized, and being proactive. And the stages of grief, again, this is something from the Adjusting to Suddenly Reduced Income publication. When people experience a major income loss, they go through certain stages of grief. And those are the stages of grief that we experience, whether it's a death or a loss of a job, whatever the situation might be that we're grieving. And so in the first stage, the shock and denial, the way that it influences our money planning, our spending, is that we experience the shock and denial, and we may need to think about making decisions related to the income that is lost, but that ability to make those decisions or the need to make those decisions might not yet be recognized. In the second stage with anger, okay, we all experience the frustration, the anxiety, all of those items listed on the slide, but our emotions may not let us handle those decisions quite yet. It may make it very difficult to deal with. Similarly, going into the third stage of depression and detachment, during that stage, we might have low energy to make decisions, and it might be difficult for us to focus. It's also important to remember that if a person is clinically depressed, they may need to seek some professional help to address that. Going forward into dialogue and bargaining, that fourth stage, at this point, we actually might start to open up to some options and some planning ahead. And in that fifth stage, acceptance, we're beginning to feel empowered to make decisions again. We don't necessarily like the change that's occurred, but we accept it. And that's the point where we're beginning to feel like there might be a meaningful return to life. And it's also important to remember that we don't go through these very systematically, just moving from shock and denial to anger to depression. Sometimes we circle back around to some of those, depending on what else is happening in our lives. And so those previous stages pop up again. And how quickly we move through the grief process depends on the intensity of the meaning a person places on the change that has occurred. Willingness to change doesn't come at the same time for everyone and happens gradually. And we want things to be the same always as they had been. As a result, people don't make those immediate changes. As we talked about, some of those decisions that we need to make early on in the process may not happen right away. And so when people are not making the immediate decisions and changing spending to compensate for income loss, we see that very often the spending stays about the same level it had been while the income decreases. And what we have found is that people who make changes more quickly are generally more satisfied with the adjustments that they needed to make. Some may not make adjustments because they're just stuck in one of the stages of grief that we talked about. And so certainly making those changes in our spending plans that accompany the reduced income, the earlier that we can do that, the better. And identifying individual goals as well as family goals will help to make decisions about spending priorities and the goals moving forward a little bit easier to deal with during a reduced income situation. And if you're involved in a family business, obviously that adds another layer to it. And we see that this process can be quite an undertaking as we go through something like this pandemic. You know, there are many businesses, small businesses that have been impacted too. So those individual goals, family goals, as well as just layering on a business goal as well. Important things that need to be handled. And coming to agreement with goals and priorities, spending priorities, will help to use the existing money most effectively and reduce conflict as we're able to. Something we need to point out that oftentimes fear and stress that is caused by uncertainty of the situation is worse than directly addressing the problem. So we really ask people to take the initiative to make a spending plan, even though you may not have done that in quite some time. The not knowing is often a bigger problem and a bigger stress on people than seeing what the situation actually is once it's laid out on paper. So at the very least, if you have not made a spending plan in the past, do so. Make that plan, and it's your plan for moving forward. We already mentioned involving family members in the spending decisions and adjustments that need to be made. Of course, family members will be more willing to accept decisions if they understand the tough choices that need to be made and they have a voice in making that decision. They're more willing to accept the decisions if you're able to talk, to listen to everyone, involve them, and support each other through the decisions. So how do families handle reduced income? Well, generally, when we talk about this in a normal situation, we talk about increasing income, decreasing spending, or doing a little bit of both. And we know that in our current situation, there are probably not too many opportunities to increase income. So we'll try to concentrate on the reducing expenses and maybe trying to find some other resources as well. But eliminating and reducing spending on the non-essentials. We want to reduce spending to the basic needs. Revise those budgets. So look at what happened before and then what is happening now after the situation. Increasing income, I have to say that even though it's not as much of a focus for us now, there have been some people that I've seen that have been very creative in how they've been able to do some production at home and increasing income through those efforts. And so I'm not ruling it out. I'm just saying it's very difficult right now. But if you're a creative person and you can find some ways to increase your income, that's great. One thing that we mentioned on this slide, and we're reluctant to do that, is the use of credit. Generally, credit is not recommended as an option, but it is for an emergency situation, and also depending on your ability to access credit and the duration of such a situation, and knowing that you would be able to repay when the bill comes. And that's why it is generally the last resort that we talk about. If you don't have a current spending and saving plan, it's a good idea, a good time to do this. It's helpful to look at income and spending before the situation, as we previously mentioned, and then take a look at what is available now. And so a spending plan helps you to make those decisions about how to spend the money, provides for needs before wants, matches the spending to the current income. And again, that family argument over money situation, the more we talk about the situation and help people to understand what is happening, the more they're willing to accept the situation. When we talk about making a spending plan, identify the income that is available, look at the monthly expenses and think about what must be paid first, and then come to a balanced bottom line. In step one, looking at the take-home income, so that's what we're using, take-home or net income amounts. We also want to look at what you actually have available, so that's why we're using the take-home. We're looking at earnings, unemployment, savings, tips or commission, interest or dividends, Social Security, child support or alimony, public assistance, veterans benefits, whatever you have available now, actually at your availability to use. Step two, the monthly expenses. Most importantly, what are the essential items that need to be paid? And we'll take you through a few different pieces of this. Certainly those immediate needs, what are those expenses that are essential? What is the highest priority? Which areas can you reduce? And how much can you afford to spend? Balancing the bottom line. Ideally, we want you to come to a zero balance, but there are likely to be a number of questions that are left unanswered related to bills that need to be paid. And it's important to remember that if you're unable to pay, to contact creditors to let them know what the situation is. Certainly people are not alone in responding to creditors right now. There are very many people in the same situation. And so it's not unexpected for a creditor to receive a call. Don't feel like you're alone in that process. I know that Antonio has some information later that will address more about contacting the creditors and such and making arrangements, but we'll keep moving on this, and he can share the information as we go further. So we want to size up the situation, thinking about how long this situation will last. How much monthly income can you count on? What is the minimum that you can count on that you can begin planning with? How much money is needed to cover the essentials? And think about the creditors that are owed. What's the total amount due? Are there any assets that could be used to pay off debt? And what debts are most important to pay first? And are there debts that could be satisfied maybe by surrendering an item, giving it back? Think about those things as well. Number one is, what will affect your family's health and security the most? So think about what those priorities are. And again, in just establishing that spending plan, food, housing, utilities, transportation, medical care are going to most likely be your priorities. Perhaps there are others that are individual to your family and you need to consider what those would be. Another question to consider is, what are the consequences of not paying? And certainly we want you to pay all of your bills as you're able to, but there are situations that we need to consider what might be necessary. And so again, contacting creditors to look at the options is something that can help you to make decisions and take away the fear. Not knowing sometimes is more of a problem, as we pointed out earlier. And so if you make those contacts and ask questions, explain your situation, that is certainly more helpful. When you're looking at loans and balances that need to be paid, consider paying off low balances first if you're able to. We talked about returning or giving back items. I've seen a lot of people selling items as well. And so those Facebook Marketplace kinds of things or eBay, certainly people are out there selling items that they perhaps are not using. If you do have outstanding balances on credit card, can you make the payments, the monthly payment, just the minimum amount to keep it current? Also compare interest rates to make sure that you have the lowest rate. If credit is a problem, then you may need to destroy the cards and close accounts. And so those are things to consider as well. One resource that we would like to share, and I know that I have used it with financial counseling clients over the years, and I know that other extension educators have turned to this as well, the PowerPay online program. And this is from the university, Utah State University, and helps you to determine how best to pay down debt. And it may help to save some money if you're able to pay down. Now, not everybody at this situation is able to deal with paying off or paying down debt. But if you are in that kind of a situation, certainly PowerPay can help you to take a look at what you owe currently. And for example, it helps you to establish that PowerPay. And the PowerPay idea would be, let's take a look at this slide, and let's say that with the two loan balances that are identified here, if we're making a $25 payment on the very first one listed, perhaps we have paid that, we're making our last payment, and next month going forward, we would have an extra $25 in our plan. And so the idea of a power payment then would be to take that $25, add it to the other loan that we're paying on, the $150, and all of a sudden you have $175 in your monthly payment to pay down more quickly. And so that is the concept of the power payment, and it helps you to take a look at paying down more quickly. We'll show an overall example of how that might, how PowerPay works. So in this example, we see that PowerPay has actually, as I say, juggled all of the bills that need to be paid. They have looked at, is it better to pay off the highest interest, the lowest balance, the shortest term? Though in this case, they end up to be the same situation, the same amount saved. But if you see that there are no PowerPay applied here, you see the difference from the 3 years, 6 months for any of the other options to without power payments, 9 years, 9 months. So it makes quite a difference, and quite a bit of difference in terms of the interest paid there as well. So this is a great tool if this time of the pandemic is a time that gives you an opportunity to deal with paying down and paying off some debt as well. This would be a great tool that we would suggest. Again, that's not the situation for everyone, so we acknowledge that. What about credit reports? And again, I know Antonio will be dealing more with a little bit of the credit information coming up related to the COVID-19 pandemic, but currently, you know, in a normal situation, late payment and non-payment of bills are recorded on a credit report, and those can damage your ability to get credit or to increase the cost of credit. But we know that during COVID-19, there are adaptations being made. And just a reminder that your credit report is available. Each of the 3 bureaus provide your credit report free of charge at annualcreditreport.com. And again, we'll have some more information that is pandemic related as well. We also wanted to direct you to some Tough Times resources. I know that there are a number of universities that have a similar type of series in their information, but want you to know that there are some items related to getting help, financial decisions with less, dealing with stress, figuring out how to do with less, and children in tough times. So you see ours listed there as well. And now Antonio will continue with more information related to finances during the pandemic. Oh, Antonio, you're on mute, sorry.
Sorry, I wasn't in mute. Thank you, Lori. As we all know, we are living a special time, and even in this time we have also some new and special resources, and some others they are there for a long time, and it's important to be aware of those resources. For instance, one of the new resources we have is the Coronavirus Aid, Relief and Economic Security Act, or the CARES Act. We have state resources and community and other community resources. As in times before COVID-19, elimination of spending in non-essentials or wants is advisable to meet ends, especially in this time when many people have lost or reduced their income. Even reducing spending in basic needs helps to stretch the scarce money resources. It's important that individuals and families, when getting the benefit of government and community benefits, or even negotiating with creditors, maintain a good relationship. Maintaining a good relationship will help to diminish some of the most risky life stressors, like the financial issues. Next, please. Next slide. Thank you. Decide which bills to pay first, or what are the bills one needs to pay first. What are the measures convenient to avoid? It's a good idea not to request new credit cards, ask for home equity loans, and prevent borrowing money from financial institutions, car title loans, and others. Except borrowing money from family members, even from some close friends. It's important to focus in times of economic crisis and not economic crisis to cut spending, especially of those articles and services we don't need for a healthy life. Negotiate with your creditors to reduce payments. Many of them are open to negotiate in this time. It's important to look in the family and close friends support system. It's so important. It's crucial also to watch for available community resources. Next, please. Negotiate with creditors is not so easy, but it's possible. Even UVM extension suggests that it's key to take some steps when negotiating with creditors. For instance, what are the credits to pay first or give priority? This is a good question. And there are some points in your favor if you contact the creditors before they contact you. In order to negotiate to explain your economic situation, and due to the coronavirus situation, some meetings in person are not possible yet. I'm talking about the creditors. And then use other means of communication, such as phone, a letter, or email. It's very important, a serious plan of payments, because it has to be very serious and not propose some repayment plan just to be out of the hook. We need to be formal. We need to observe some formality in this. Remember when you are dealing with your creditors or negotiating with your creditors, make copy of dates, names, and of course, write your proposed payments and save a copy. Next, please. Negotiate with collection agencies. Again, Save names, the phone numbers, and or save any correspondence. Any letters you receive, please save it. Check the account number. If you don't have a statement in writing, please request a statement in writing. Be calm. Panic doesn't help in these situations. Share your financial or economic situation and how you plan to pay your debt. Remember, it's important to create a repayment plan. It has to be serious. It has to be realistic. And it's important because creditors, they like we contact them instead they trying to contact us. So sometimes there are inconsistencies in the information. If that's the case, report it. Remember, you deserve respect from the collection agency employees. Next, please. There are some resources to negotiate with creditors, and you can access and use to help you when negotiating with creditors. Extension educators, extension agents, or financial capability educators may help you. We have also in the community, in many communities, counselors and coaches from the association, for instance, from the Association of Financial Counseling, Planning, and Education. They may help you too. If there is a risk of home foreclosure in Minnesota, for instance, you may contact the Home Ownership Center. This is a nonprofit agency specialized in home buying and foreclosure prevention. If you have in your state, or if you live in another state, you may contact the Federal Housing Administration or HUD to seek for a housing counselor in your state. There are other nonprofit agencies in the community, and they are members of the National Foundation for Credit Counseling, the NFCC, and they provide services in English and in Spanish. Next, please. U.S. unemployment increased dramatically in the COVID-19 situation. In April, the unemployment rate was of 14.7%, and 20.5 million people lost their jobs. In a latest report from May, from the U.S. Department of Labor, it was reported 38.6 million of unemployed people. That include 18% of temporary layoffs and 2.0 million of lost jobs. Sorry. There is something interesting. It's not in the slide, but I wanted to share this. Latinos and African Americans show the greatest economic or employment affectation. A similar trend is showing the number of deaths for COVID-19 for African Americans and Latinos and Latinas compared with the whole population of some states. For instance, Michigan, Illinois, and this information is for the public health, the state public health from those states. Next, please. Unemployment insurance, let's talk about this. There is the regular benefit and the economic benefit. This is the one related to the COVID-19. The regular unemployment insurance covered for 26 weeks, is the economic benefit for additional 13 weeks. It's important to consult with your state about the eligibility and requirements for the person or the people you work with, or even in you are in this case. For instance, in Minnesota, basically, we have two different ways to contact the unemployment insurance office. One of those is application by phone, and we have different phone numbers. They are on the slide, especially if you live in the metro area, Minneapolis, St. Paul, or if you live in the rural area. Even you can reach the unemployment office, unemployment insurance office online in www.uimn.org. Next, please. Health insurance. The Minnesota Sure, we have a Minnesota Sure in Minnesota, and the normal enrollment period is closed. However, there is a special registration period, especially for those people who have a new baby, or a family member is 26 years old, there is a recent marriage, or there is a loss, or somebody will lose the work health insurance. It's important if you are looking for some insurance, health insurance, to contact the Minnesota Sure navigators because they are so useful to find medical assistance in Minnesota Care if you qualify for that. And to find a navigator, there is the online address in the slide, and they are so helpful. They are so helpful in this time. They are so. There is a key resource, a community resource. Next, please. Food insecurity. Food insecurity is defined by the USDA as a lack of consistent access to enough food for an active, healthy life. Food insecurity is 2 times more in 2020 than 2018. In 2018, 11 million households and 22.7% of households. Now we have in April 2020. That means, yes, we have 2 times more in 2020 than 2018. Those households in 2020, including 9 million people with children with no income to get enough food in just a week. And this report was very recently, was from May 2020, and it's according to the U.S. Census Bureau. Cooperative extension and nonprofit community agencies may help clients and program participants to identify and access community resources as the Supplemental Nutrition Assistance Program, the SNAP, the WIC program, and the National School Lunch Program. Next, please. We mentioned 9% of all American households with children are food insecure. 35% of households headed by a single woman are food insecure. 26% of Black non-Hispanic households are food insecure. And 22% of Hispanic households are food insecure. The source was a Salvation Army, and it was based in a USD report. For instance, in Minnesota, 1 in 11 people are having issues for not having enough food, and 1 in 8 children is struggling with not enough food. I'm showing in this slide some sources for food banks. They are locators of these food banks, and they are very used in the last weeks, even months, for people in Minnesota. Even if you live in other states, you can go and use those because you will be able to locate the food banks in your state and close to your community. Next, please. Regarding Regarding federal student loans, for instance, the forbearance, under the CARES Act, direct loans, they are in forbearance or payment temporary postponement. And this is effective until March 13, from March 13 to September 30th, 2020. Not interest is charged in this time. The forbearance applies to direct loans, some federal family education loans, the FFEL, and some federal Perkins, and some health education assistance loans, the HEAL loans. And then if we want to go to the studentaid.gov login, we can find which loans they are federal. For instance, you have a client and they don't know how to navigate this. This is the first step to do this. And the second one is to call to this 18 number to check who is the loan servicer. And this is important in order to make some arrangements with them, because somebody can have several student loans, but maybe some of them they don't qualify for this forbearance. Next, please. Renting under COVID-19, according to the U.S. Census Bureau, 25.7, practically 26% of households where somebody lost his or her income and did not pay or defer the rent just during April. Some states have suspension or moratorium, suspension. Minnesota has an eviction and rent payment suspension in public housing from March 27th to July 25th. If you can pay the rent, please pay it. If you can, please pay it. Remember that delayed payments are still an obligation. Each state, county, and city have their own legal provisions. If you live in another state, please, you can check with your state, with your county, with your city. And if you need more information in your state or in Minnesota, please call the Housing Counseling Agency and that 800 number on the slide. Next, please. Foreclosure prevention is a foreclosure prevention in non-federal bank mortgages. Please contact your bank immediately and explain your situation. Federal bank loans are protected until June 30th, 2020, and loans such as FHA loans, USDA loans, Veteran Administration loans, Fannie Mae, and Freddie Mac loans. Resources to help to find your mortgage servicer, foreclosure prevention counselors, and Minnesota State Civil Rights. You can contact the Minnesota State Civil Rights in case of acts, some acts of discrimination. Next, please. We have a new program. This program basically has just a few days. Is the Energy Assistance Program based in the current situation. This program, we have a lot of years with this in Minnesota. But now there is a special support, especially in home heating for renters and homeowners. And basically is to avoid energy disconnection and furnace repairs. People living in a household without a social security number may benefit in some point. Next, please. There is one more resource, and we have this resource in Minnesota, but you can have this resource in other states as well. This is the support from foreign consulates to their connationals. They usually support people with access to food, housing, some economic access to some economic resources, access to health care, and help in case of high-risk situations, for instance, domestic violence. And then they are foreign consulates. They are in the main cities or capitals in the U.S. In embassies and foreign consulates. For many people, it could be in some point the difference to survive, at least to survive under this COVID-19 pandemic. In this summary is to try to keep a positive attitude. Calm is so important. Panic doesn't help to anybody. Take action quickly to make a plan. Look in or create your spending plan. Check your spending plan and reduce spending. Identify priorities in repayment. And again, make a repayment realistic and repayment plan. Contact creditors. Look in community resources and programs available to help. Do you have questions?
Antonio, before we get to questions, I just want to reiterate that as we were preparing this information, you know, we asked people to look at what they currently have in terms of income and their current expenses and try to balance that out. But those community resources that we shared that are particularly available now during the COVID pandemic are really important to make to help to make those other resources that you have, the other money that you have, just stretch as far as you can. So I think very often we have the feeling that, oh, those resources aren't meant for me, but they truly are meant to help people in situations such as this. And so we want to make sure that people realize that, you know, that just helps you stretch those dollars that you currently have. So maybe you can make a payment that you didn't think you could, or things like that. So we really just want to make that emphasis. So it looks like maybe we have some questions or some comments coming in. Let's see. Okay. Let's see. Yes, all the resources and the links will be emailed. I see we had a couple of questions about that, and Sarah had clarified that we will be emailing all of the information following the webinar. We will have a recording too. Sometimes that takes a little bit longer to get the recording, so we'll try to get that out as soon as we can to everyone. Did also want to mention that we have Sarah Kremens and Samantha Roth on with us today, and they have pulled together a group of extension educators to have a series of webinars. And coming up, and the flyer will be sent out along with the information that you receive following the webinar. But we do have Budgeting 101, Making a Plan, coming up. That is on Thursday of this week, May 28th. We have an afternoon and an evening session for that, 3 to 4 p.m. and 7 to 8 p.m. We also have Mental Well-Being, Resilience and Self-Care. That will be Tuesday, June 2nd from 11 to 12. Budgeting 201, Managing a Plan, will be Thursday, June 4th, again from 3 to 4 p.m. and 7 to 8 p.m. Remember, these are central times. And we have COVID-19 Scams on Tuesday, June 9th from 10 to 11, and also from 7 to 8 p.m. And then the last one, Sarah and I will be doing Preparing Your Finances for Disaster and Pandemic, will be Tuesday, June 16th from 11 to noon. And then we also have a professional, purely professional webinar that will be on the rental crisis. That will be Thursday, June 11th from 9 to 10 a.m. And so those are what we currently have available for webinars coming up. I see there's a question here. Let's see, or maybe it's let's see. Christina, for those who received COVID fuel assistance, will they then be eligible to receive again? And if so, when? Do you know the details on that, Antonio, or we can certainly get back on that one?
No, I don't have that information yet about when they will be able to receive again the fuel assistance.
Christina, we can check on that for you and get back to you. We know how to find you.
Lori, this is Sarah. I
Yes.
saw an email this morning that the Low-Income Energy Assistance Program has extended their deadline to July 1st, and the annual crisis maximum has increased from $1,200 instead of $600. So folks should definitely contact their local community action program or whoever manages those energy assistance programs.
That's a good point. And as we said early on, the information is moving pretty quickly. And as you know, we have stay-at-home orders or stay-safe orders and things extended, we know that some of these deadlines will be extended as well. So we just need to keep our eyes open. I think, you know, when we're looking at community resources, it's important to try to stay connected and to ask questions in the community and to get the best information that we can. So it's not maybe just asking a question once, but maybe we need to ask a number of times to make sure that we have everything clarified, and information is moving very quickly. All right, I don't see any other questions at this time.
I want to make if there is no question, I want to make a comment very quick. The past Saturday, I was in the radio and somebody asked me about how to reduce expenses from basic needs now under this COVID-19 situation. And one of the answers was to, for instance, in clothes, we still can save some money in clothes, especially if some clothes, they are still usable, they are in good shape. Even in food, the nutritionists, nutrition people from the cooperative extension, they can offer lots of ideas in how to replace some menus, expensive menus for less expensive menus, and at the same time very nutritious. And this is one of the other opportunities we have in this time to share with the people we work with about, for instance, the SNAP program. And even in medical consultations, we still have the opportunity to call the nurse instead going to the clinic, instead going to the hospital. And of course, depends on the situation. But at least many people still have that option to call the nurse, and in doing that, the person can save some money for the consultation in the doctor's office.
Yes, and I would say too that as you mentioned, the SNAP educators, we have a number of them on with us today, and there is the 14-day meal plan. There are a couple of different meal plans that they've put out to help look at stretching those resources, the food resources, as much as we possibly can. So that's a good point, Antonio. And I know you've been hearing a lot of the concerns as you've been on the radio programs on Saturdays, as people are calling in and asking questions of you. So that's great to help us understand what people are really dealing with. So at this point, let's see, we are 4 minutes to 11 o'clock. Do we have any other questions coming in? Okay, seeing none, we just want to leave you with our contact information. Please feel free to contact us. And again, we will be sending out an email with the resources from this webinar, sharing those with you. And I hear Sarah on there as well. What do you have another comment, Sarah?
Yep, there was one question from Michelle about MNsure being closed, ? She indicated her daughter's insurance is up for renewal and could be canceled. And what does the closure have as an impact for her? If you could review.
Yeah, I did answer that in the chat for her. I believe that MNsure has a special period open right now, and so she should contact and make sure that she's able to get covered.
Perfect, thank you.
Even I suggest to to get a Health Minnesota Sure Navigator, and they can offer answers to specific questions like that.
Yeah, and those navigators are wonderful. They do know the ins and outs of MNsure and looking at those programs that are available. So yeah, certainly contact a navigator. That's one of the resources that is available here too that we can share again. So, all right. Well, thank you everyone for being with us today. We so appreciate it, and we hope that you found some useful resources today. And be sure to check out those upcoming webinars if there are any that look interesting to you. We certainly hope that you will join us for future offerings. Thank you.
Thank you.